Non-hormonal birth controls, take 2. Hey everyone, it's me, Hallease. I am back with another Clue Voices video. This time we are talking about non-hormonal birth controls. Let me first say that with all of these non-hormonal birth controls, having conversations with the person that you are intimate with is important. So let's get the first one out of the way, which is abstinence. Abstinence can vary depending on your definition. Some people don't mind just, grinding with some clothes on. And for other people, they count oral as still being abstinent, etc. But essentially the idea being that you are not having penetrative sex. So penises are not entering vaginas and therefore pregnancy is being avoided. Abstinence is 100% effective when done correctly. Next is female and male condoms. I think these are the most well-known forms of non-hormonal birth control out there. Basically, this is either a latex or latex-like material that you can put on the outside of an erect penis, or you can insert into the vagina. Essentially, they are one-time use products. You use them once during sex and you throw them away. You do not reuse condoms, but they can be very, very effective, not only at preventing pregnancy, but also preventing STDs, which is good. Keep in mind that condoms can and do expire. Look at the expiration date, and they can break. The next method is the withdrawal or the pull-out method. That requires a lot of trust between partners and requires a lot of self-control and restraint on the part of your male partner. So with withdrawal or the pull-out method, essentially when you are having sex, once the man feels like he's about to ejaculate, he pulls out from the vagina and ejaculates somewhere else, anywhere else. Just not in you. That is how you prevent pregnancy. It can be very effective. However, because of the spontaneity and the passion that I think is inherent in sex, it can be very difficult to perform it perfectly every time. So, once again, having a long conversation with your partner about this method is very important, and also knowing your partner's restraints and control and all of that. Working up to the pull-out method is something that I've heard of couples doing, starting off using condoms and then, getting the rhythm down, getting the motion down, and then eventually moving to the pull-out method. So there are options. Just know thyself. Know thyself. The next method is the rhythm method or the calendar method or the cervical mucus method. It has many names because essentially it is about knowing your body's anatomy and how your body naturally shifts and changes throughout your cycle. One of the best ways I would say to accomplish this method in the most accurate way possible would be to use your Clue app. Use your Clue app to monitor all of the different things that you can to know when you are most fertile and to avoid that time. Clue, if you are consistent about putting your information into the app, will naturally let you know when your fertile window occurs. So don't have sex during that time. Knowing things like your body temperature and when it's changing, knowing things like your cervical mucus and when it changes are all signs of when you are the most fertile and when to try to avoid sex during that time if not having a child is your goal. The next form of non-hormonal birth control is the IUD. Basically, it is a little tea-like device that you insert into your uterus. It has to be inserted by a medical professional. You cannot do it yourself. And it essentially physically blocks pregnancy from occurring. Now, the IUD is very effective and can be used for up to 12 years. However, it does come with a lot of side effects. So definitely talk to your gynecologist about if it's an option for you, because some of the side effects include prolonged periods, an increase in period pain and cramping, and also like breakout bleeding, breakthrough bleeding, things like that. So it's a great option, but just, have a conversation. Another one is breastfeeding. So knowing that you're breastfeeding, your body is naturally not releasing the hormone that allows for ovulation to occur. And so because of that, you won't get pregnant. It's supposed to last for up to 6 months after giving birth. But again, all of these methods can be used in conjunction with another to be more effective. Another method is spermicide. Now, spermicide, what that does is essentially it prevents the sperm from joining with an egg. It's usually like a kind of gel or a paste or something like that. And a lot of times spermicide is used in conjunction with some other kind of physical device. So a cap or a sponge. And essentially you insert those things into your vagina with the spermicide already on it, and it helps prevent pregnancy. They aren't as effective as other forms of birth control, but are definitely something that you can use as a backup with the birth control that you are using. So if you have condoms and you want to do spermicide on top of that, bet. Finally, the last non-hormonal birth control that I will go over in this video anyway is the vasectomy or female sterilization. And essentially what those are medical procedures that hinder you from having children. They can be very, very effective. In fact, so effective that they many times cannot be reversed. So this is something that most people don't get until they've already had the number of children that they want to have. Or if they are very, very sure that having children is not something that they ever want to do. With vasectomies and female sterilization, again, it's really just about knowing yourself and knowing what you want for your future. Just make sure that you are well informed, because again, it's not very easily reversed, if at all. So yeah, those are all of the non-hormonal birth controls that I have decided to cover in this video anyway. If you would like to learn more, especially if you want to learn their effective rates and proper usage and technique, definitely check out this wonderful website put together by Planned Parenthood. I will link to the website down in the description box, if not at the bottom of this screen. They really do lay out so many different types of non-hormonal and hormonal birth control methods for you, and how to do them, and best case scenarios and effectiveness, and so on and so forth. Planned Parenthood really is such a great resource. In the comments below, let me know if there is another topic you would like me to cover with this Clue Voices series. I'm Hallease, and I will see you when I see you.